Um, and how is that looking? That's okay in my room? All right. So like Ruth said, I'm Dr. Kylie Fisk from the International Women's Development Agency, and I'm going to be talking specifically about some of the findings that we have in our report that we've called Gender Insights in the Solomon Islands, findings from a 2-province study using the individual deprivation measure. And I want to acknowledge our individual deprivation measure partners with the Australian government through DFAT, the Australian National University, IWDA, and our Solomon Islands study partners in the UN World Food Programme. So from the overview of this study to start with, from January to April 2020, we conducted the IDM study in Central and Guadalcanal. And the aim of the project was to gain insights into the economic, social, political, and environmental dimensions of the lives of men and women in Central and Guadalcanal provinces. Just a little bit of background about the IDM. So it's a gender-sensitive measure of deprivation that challenges assumptions about the nature of poverty. And these assumptions are that all members of a household can reasonably be assumed to share the same economic circumstances. And secondly, that monetary is a reliable and meaningful lens through which to measure poverty. The IDM program has been a 4-year program that just finished in June this year, so very recent. As I mentioned, a partnership between ANU, IWDA with funding and strategic support through DFAT. And this is part of DFAT's broader efforts to close the gender data gap globally. The program has combined a focus on methodological refinement, testing, trialing, data collection, and advocacy and communications. Over the last 4 years, we've had data projects in Nepal, South Africa, and Indonesia, and Solomon Islands was the final, and I'm a little biased, but I think the best study in this program. The IDM method is that we interview all adults in the selected dwellings and households. So this is a change from typical metrics where the head of the household is approached and asked questions that are assumed to be shared by the whole household. We're interested in data from every individual 18 plus in the dwellings. And then our survey modules, as Ruth mentioned, assess 15 dimensions of deprivation. Those are the keys to the right there. So food, water, shelter, health, education, energy, sanitation, relationships, clothing. We actually didn't administer the violence module in Solomon Islands because we were still working on some methodology refinements. But the others are family planning, environment, voice, time use, and work. And then we also administer an individual level asset ownership and control module. Just really quickly, some other findings outside of the Solomon Islands study that we've found under the program. So evidence from Fiji has suggested that individuals in the same household really do differ significantly across our economic, social, environmental, and political dimensions, and that measuring individuals within households uncovers previously invisible gender inequalities. So this is the core findings of the IDM. When you measure at the household level, you miss gender inequality entirely. At the end of the 4 years, independent evaluations of the IDM program have found that collecting data from multiple households doesn't produce redundant information because household members are sufficiently different to each other. So this is one answer to those challenges that we're making about the nature of poverty. We do find that people in households are very different from each other. And then crucially, I think for investing in these data collection methods, development initiatives found that it's actually more cost effective to collect data from multiple individuals in a household rather than simple random sampling of individuals, because from a fieldwork perspective, you're already at the household. So you may as well collect 6 data points rather than 1. And these 2 pieces of information combined, I think, really make the case for this methodology. So it's cost effective to interview multiple people, and individuals in households are different enough from each other that it's worthwhile from a data perspective. Just to link into some regional mechanisms that the IDM is a part of. So the SPC UN Women Pacific Roadmap on Gender Statistics, IDM is in the advisory group towards that, along with some of our colleagues from Solomon Islands Government Statistics Office and the Women's Ministry. Implementing an IDM study is a country and regional level indicator towards the progress of the roadmap. And the IDM is named as a specialized survey that addresses gender data gaps alongside some pretty big surveys like the Mix, the DHS, and others. To get into the Solomon Islands study, we've already, Ruth's introduced a lot about the method and the experiences during data collection. But from January to 2020, we ran the study in the 2 provinces. I've already mentioned the collaborative relationships, partnering with Ruth through Dignity Pacific. And we ended up with, despite facing challenges from cyclones to a global pandemic, we have 1,862 individuals from 849 households and a nearly exact equal split between men and women in the sample. So I think this is a really exciting amount of data that Ruth and the team have been able to collect in this time. I had to put this photo up. I think it's such a beautiful photo and shows the room in the mood in the room when we were doing our study as well. This is our Dignity Pacific team and Ruth in the middle as the queen of data. And just thanks on this slide to everyone in the room. It was such a lovely team, and despite all of the external hardships that we faced, everyone stayed positive, stayed working hard. So I can't name every person individually, but we've named every single enumerator in the acknowledgements section of our report because literally we couldn't have done it without this team. Also, just to mention our research steering committee. So prior to any field work, our first port of call was to establish a multi-organizational steering committee. So thanks to our representatives from the Women's Ministry, the National Stats Office, the Women's Rights Action Movement, and the National Council for Women. From the start, from December last year, they've provided support, technical advice, guided project design, implementation, focal analyses, and then from now, I think a lot of you are in the room because of the connections that our steering committee have. So special thanks to everyone on the steering committee. Ruth has spoken to this, but just very briefly, there was 2 weeks, actually 2.5 weeks of training in the IDM survey and methodology, as well as gender diversity and disability inclusion training for our enumerators. We had staff from the Women's Ministry and the Stats Office attending training and enumeration as capacity building activities. So thank you to the government statistician and the PS of the Women's Ministry for releasing staff and acknowledging the importance of capacity building around gender data. And as Ruth said, enumerators conducted the surveys in the field with individual participants away from other household members, with men interviewing men and women interviewing women, so that people were comfortable with giving them answers to sometimes pretty personal questions. The IDM surveys, the dwelling survey takes about 5 to 10 minutes to administer. The household survey takes about 18 minutes to administer. And the individual survey takes between 1 and 2 hours, depending on literacy levels, with every single adult in the dwelling administered every single module of the IDM. So as Ruth said earlier, it's a long time to spend with people, but the richness of the data is really worth it. Just wanted to give an overview of the report. I think there are some copies in the room. There also should be links that were provided to you in the invites. We also have a QR code that you can scan on your phone that I'll send out following the meeting, and that links you directly to the report. But just to give you a sense of what's in it, so the first set of sections is the dimension sections. They offer analysis from the 14 enumerated IDM dimensions. These are extracts from the report. We go through one by one, each dimension giving you key statistics across these 14 dimensions. We know that people are busy and often don't have time to read a 100-page report. So we've made the effort to pull out some key findings to highlight using these icons. So throughout the report, you'll notice in every section, there are policy notes that link to Solomon Islands, regional and global policy links relating to data, the SDGs, to the National Development Strategy, to the Women's Economic Empowerment Strategy. Our gender spotlights highlight findings that we think are particularly relevant for gender analysis. Emerging strengths are where we see real strengths in the data. These are gains to be able to build on. Emerging challenges are where we notice some gaps in the study. And priority rankings, I'll explain a bit later, but this is where participants were actually given the opportunity after the survey to tell us what the most important issues were for them. So we combine these subjective and objective data to create a full picture of people's priorities. Every dimension has a heat map as well. So this is where the dimension scores are visualized in quintiles. So this is an example from the food dimension, where at the ward level, darker colors represent relatively more food deprivation. And it's just a nice, easy map for policymakers to look and see where efforts should be concentrated in, for example, food security. Then we have in focus sections. So these are a bit more on the analytical or technical side. These explore insights that the IDM methodology can offer into intersectional inequalities like gender and age, gender and urban rural, joint deprivation. So that's the example on the screen where we can look at overlaps in deprivation between, for example, energy, water, time use. There's a section on differences inside households with some case studies in it. And then the priority rankings exercise, which is where respondents give their views on the deprivations that matter most. And I'm going to present a little bit of data on that later. Finally, in the report, we have 3 thematic sections. So these were themes that were identified by stakeholders and donors as where they'd really like to see some more in-depth analysis. So in our case for this study, we have not just a section of the report, but also a separate brief on each of these: gender, food security, and resilience. We have a section and a brief on gender and COVID-19 prevention, and a section in the report and a separate brief on women's economic empowerment, which I will talk a little bit about later as well. So now I'm just going to go over one slide for each dimension and then some key findings. And all of the photos throughout this presentation are of our enumerators as well. These aren't of actual participants for privacy reasons, but our enumerators got used to being photographed during the training session. Okay, so first of all, the food dimension. You can see at the top, I'll present, I won't go into it too much, but basically the way the IDM is structured is that we have these dimensions, and then sitting underneath the dimension are themes. It can be between 1 and 5 themes. And then sitting under each theme is the indicator. So you'll get a sense at the top of the slide of what the structure of the dimension is. And then I've just selected a few key findings to show you today. But of course, everything else is in the report and available on request as well. So with food variety was found to be a pressing concern of all of the different types of food security. 48% of women and 62% of men had only eaten a few kinds of food in the previous month. Older women were more likely to be food insecure than older men. And this is really interesting. This is the overlaps with food security that you get from a multidimensional measure. We found that food insecurity was associated with increased levels of anxiety, especially for women, with more short-term health problems, especially for women, with lowered voice in the community, especially for women, and with decreased resilience to shocks, again, especially for women. So these relationships were there for men, but they were particularly strong for women. And we see the overlap between food security and other types of deprivation. And then we have the emerging strength there of nearly 40% of women in Guadalcanal had experienced no food insecurity in the previous month. The water dimension, we look at drinking water, domestic water, and threats that people might face when they're collecting water. So we found that nearly 80% of respondents said their drinking water source was always or usually reliable, and 81% said the same for their domestic water source, so for cooking and cleaning. And this was a gendered finding within there. So even though men and women share the same household water source, more women than men reported not having sufficient domestic water for their needs. And this likely reflects gendered roles and responsibilities inside the household. The shelter dimension, we measure themes of habitability, so housing materials and crowdedness, ownership of essential household items, and security of tenure. I think this is a really interesting finding. Again, men and women literally share the same household, literally share the same structures and dwellings, but we still find gender differences. So more men than women said they had adequate bedding, such as blankets, mats, and mattresses to sleep comfortably. When we presented these findings to our steering committee, the hypothesis was that women are probably sharing with children. And so this is why they're less able to sleep comfortably and have adequate bedding. More participants in Guadalcanal lived in unsafe structures than in Central. More women than men had experienced anxiety over the possibility of eviction. And more men than women said their dwelling ownership was recognised by the government. In the health dimension, we look at physical health, psychosocial health, healthcare access, and healthcare quality. We found that more rural than urban respondents experienced health problems from inhaling smoke from unclean cooking fuel. And this is also a gendered finding, so more women than men and more rural women than rural men. And these are really high percentages as well. So I think particularly in the context of COVID, this is a finding that could be responded to as a priority public health issue. We found that roughly equal proportions of men and women had experienced a health issue in the previous month. Of those who needed healthcare, the same proportion of men and women had accessed it. We found that men reported more issues with healthcare quality. So for example, wait times, availability of drugs, the expertise of the physicians, but the majority of the samples, so over 90% of men and women reported being treated with respect while accessing healthcare. This is even though there were gaps in healthcare quality, at least people are being treated with respect. We found that more urban than rural respondents reported daily anxiety, and more women than men reported experiencing anxiety. And again, if you look at the percentages there, that's 83% of women are experiencing some sort of anxiety in the previous month. This is a really high finding that should be addressed, particularly with the gender gap there. Excuse me. The education dimension, so we look at educational attainment, which is the number of years of schooling, and then functional literacy and numeracy. So these were actually field tests that we did where participants had to do brief reading, writing, and arithmetic in the field. And so we were able to get this sense of how years of schooling and actual functional literacy and numeracy were overlapping with each other. Of course, we found a gender effect. More women than men were most deprived in educational attainment, years of schooling, but slightly more men than women were most deprived in the functional skills as well when we actually got to testing them. So the overall education gap between genders increased with age, and we did see this separation between education level and functional literacy and numeracy. That if you think about indicators, this is in the report, but SDG indicators where the targets are literacy for everyone, actually years of schooling might not be an appropriate proxy for measuring that. That these actual literacy and numeracy tests are really important to understand education and differences between men and women as well. In the energy dimension, again, households share an energy source, but we found that more men than women reported always having enough cooking fuel. We found that more men than women always reported having sufficient lighting. These are probably, again, due to gendered roles inside the household and different needs relating to domestic responsibilities. And more men than women said that they were responsible for collecting fuel for their household, but still very high levels of fuel collection required for both men and women. In the sanitation dimension, in rural areas, more women than men had no toilet facilities at home. Again, despite sharing household facilities and structures, more women than men did not have a place in their house to wash their hands. This has important implications for COVID and public health. More men than women always had sufficient water for hand washing with those same implications. And only 36.1% of women said they always had enough sanitary products during menstruation, which is a low finding for what's an essential function for women. In the relationships dimension, this is one of our social dimensions. So we look at dependence and support and participation in community events. We found that more men than women relied on people who didn't live with them for food, water, shelter, or money because they couldn't provide it for themselves. And that's with people who didn't live with them. So we don't know what dependence looks like inside households in this measure. This is just outside the household. More men than women reported always being able to reciprocate the support. Reciprocity is a really important part of community relationships. We found that only 7% of men and 4% of women who relied on other people always had enough of their needs supported by those people. So a relatively low percentage there. And more men than women, by about 10% more men than women, reported always being able to attend the social and community events they wished to attend. In the clothing dimension, so clothing is a really important part of poverty analysis, the social facing stigma. People can tell straight away it's a signifier of poverty. We look at basic clothing and footwear, for clothing for school, work, formal clothing. We found that more men than women always had clothing that was acceptable in their community outside the home, but still only around 50% men and women. We found that more men than women always had clothing and footwear to protect them from the seasons and hazards. And there's a huge gender gap there, but also quite low. Only 22% of men always have enough protective clothing. And we find that nearly twice as many men than women have at least 2 pairs of footwear. So we think that perhaps this gendered finding is an explanation could be that women are prioritizing, for example, children or other basic needs over these sort of more dignity-focused metrics. So this is an interesting gendered area of intervention that has important implications for employment and social relationships. The family planning, I think every time I present this, people are a little surprised, but we did find that 46% of the respondents were using modern forms of contraception. Modern and traditional definitions are listed in the report. 30% of the sample had no need for contraception, and 4% were relying on traditional methods of contraception alone. Just with the note that we had a little bit of missing data because people weren't willing to tell us in this dimension. So, with caveats around it, I think that's an interesting and encouraging finding. One of the challenges that we saw is that women were able to tell us why they didn't use birth control, hormonal birth control, and there were lots of people mentioned fear of side effects. So this is a public health priority that women can be more informed about the effects of birth control and dealing with side effects. In the environment dimension, we found that we look at exposure to environmental problems around the home, wild resource utilization, biomass fuel utilization, and the safety of the environment. Women were more likely to say that they felt unsafe walking around in their neighborhood. And then high proportions of all participants had their homes that lived around environmental problems such as rubbish, hazardous waste, sewage, air pollution, water pollution, stagnant water with implications for mosquito breeding, and noise was also one of the highest environmental complaints that people made. Respondents could also tell us any other problems that we didn't provide them on the list on the surveys. And the most common answers that were given were environmental issues, particularly in water sources that were caused by logging, waste and environmental damage caused by loose pigs, so like pigs that weren't tied up, damaging gardens and creating waste. Lots of people mentioned threats and impacts of sea level rise and disturbances in the environment around their homes caused by drinking. So only three more dimensions to go. The voice dimension. This was probably the most gendered dimension. We look at voice in the public domain, so voting rates, which were very high across the sample, which is positive. Participation in local decision-making processes, the ease of raising concerns for participants. And then in the private domain, we look at personal control over decision-making and the ways that men and women in the same household make decisions and who has control over them. So we found that more than twice as many women as men were in the most deprived categories, so having very little voice in both the public or the household domains. And we found that more men than women had sole decision-making power over household finances, large purchases, duration of their work, duration of their study, and their social commitments. Women tended to have more control over small purchases and child rearing. In the time use dimension, I'll just present two slides that show the results from men and women. So you're looking here at time use by men. The way that we analyze this is kind of interesting. So actually the way that we enumerate it in the field, Ruth and any of our enumerators in the room can tell you that this was an interesting exercise. So we give participants laminated cards with each of the IDM time use activities that are part of the international standards of time use classification. So you can see there growing produce, maintenance, unpaid work, paid work, collecting water, socializing, etc. And participants tell us which of the activities they did in the previous 24 hours, the previous 24 working days, so not a weekend. And then we give them 24 little coins that each coin represents an hour in the day. And then participants allocate how many hours they spent on each of the activities that they did. So you get this really nice measure that's quite participatory to measure time use, and therefore we have this detailed information about what's presented in the graph here of the percentage of men who did, let's say, paid work. So 50% of the sample of men did paid work, and of the men who did paid work, they did on average 4 hours work. So you get a sense of proportions by combining these two sources of information, how many people are doing the activity and how long are those people doing it for. And then we call the combination of that primary activities. So after sleep, the primary activities undertaken by men were paid work, followed by socializing and self-care. You can see that on this slide there. And then this is the same analysis for women. So 90% of women did unpaid work for an average of nearly 3 hours. So the primary activities undertaken by women after sleeping were unpaid work, followed by care work, then self-care. We also asked participants when they told us which activities they were doing, whether they were in charge of kids, children at the same time. And it may not be surprising, but women were far, far more likely to have a child in their care while they were also doing these other activities. The work dimension, we look at work for pay, profit and production, employment status, job security, hazards, autonomy, harassment, unpaid domestic and care work, including hazards and respect, and then double labour burden. So more men than women reported being paid for work in the previous week. Men were far more likely to want to do more paid work, with the primary reason being to make more money. More men than women were eligible for work-related contributions to Social Security or benefited from paid annual or sick leave. And that was within people who did paid work. So women who do paid work tend to work in the informal sector, and therefore only 11.9% of them had some sort of formal security. And this has implications as well for, as you'll see later in the presentation, for dealing with and responding to a health crisis as well. And the gender spotlight we've got on that slide is that the most common reason given by women for not doing paid work was being too busy with domestic duties. So you start to see the overlaps here between voice and time use and work, I think, in a way that's quite neat. Just to briefly, I'll give one example from our In Focus section. This is the dimension ranking analysis. So after participants had completed all 14 of the modules of the survey, we gave them laminated cards again and asked them, of all of the questions that you were just asked, all of these dimensions, can you tell us which is the most important in your life? If multiple dimensions are equally important, you can rank several by placing the laminated cards side by side. There's a full analysis of this in the report, but I think that the gender differences are really interesting. So shelter was the priority dimension for both men and women. The table there presents the number of people who nominated the dimension as their first priority. So there's more analysis available as well. But so two interesting findings to pull out of this analysis: women were much more likely than men to nominate multiple first priorities. So we sort of hypothesize maybe there are more priority concerns for women, maybe there are more overlapping roles and responsibilities across the dimensions for women. And then if you look at the table there, you can see that women rank voice last. Only 14 women said voice was the most important dimension, but this was the dimension where women were most deprived. And then there's also a difference in the rankings of education. So men ranked education second, women ranked it fifth. And we hypothesize whether is this a reality, an acknowledgement of reality that education is just less important, or a reflection of norms around women's voice and education and therefore the relative importance of these two dimensions. We also, in the report, provide this analysis by province as well. The thematic analysis, I think that you should have the briefs in the room. So I won't present the food security brief because I've already talked about that. But we do also have the COVID-19 preparedness brief. So this is where we've pulled together data from across the survey to provide an analysis for COVID prevention and response, acknowledging, of course, that Solomon Islands is one of the very few countries in the world with no confirmed COVID cases. But we find in this analysis that women are less prepared to prevent and respond to COVID-19 due to gender gaps and ability to access public health information. So this includes literacy and education rates, participation in local meetings where decision making might be shared, access to information and communication technology assets like radios, televisions, mobile phones. These gender gaps that I've already talked about in access to basic sanitation, including hand washing facilities, gender gaps in access to protective workplace entitlements like paid sick leave, and that big finding that I presented early, the gender gaps in health problems arising from inhalation of unclean cooking fuel that overlap with gendered roles and responsibilities inside the house that mean that women are exposed to more cooking fuel, and these health problems tend to be respiratory. So that brief is also available for anyone. And then we also have an economic empowerment brief. So this is where we pull together analysis from asset ownership and control, work, time use, and voice. These are all interconnected and can reveal information regarding pathways and barriers to women's economic empowerment. So I wanted to present some of the asset data quickly. I find this really interesting. When the enumerators went to the household, the first question is we asked men and women, do you own the dwelling at which the interview took place? And you can see about the same 64 and 62% of men and women said, yes, I own the dwelling. But then when we specifically asked the individual, do you own this dwelling alone? 74% of men say they own the dwelling alone versus 26% of women. And some of our colleagues at the Women's Ministry, when I provided them with a briefing yesterday, the feedback was, well, women might not know if they own the dwelling, like they might legally co-own the dwelling, but might not actually say it. And I think that that's really interesting, that difference between the objective situation and what your subjective perception of it is, and then because that links to the control that you then have over the asset. I don't present it here, but we ask information about who would make a decision to sell the asset, and then who would profit from the sale of the asset. And that's where you start to see these even widening gender data gaps. So perceptions influence behavior, I think is the point I want to make on that. Some summary of the other assets data. Men are more likely than women to own assets tied to productive activities, such as small livestock, fish and poultry, although you can see with the raw numbers on the side that those are still very, they still tend to be quite low levels of ownership across the sample. Men are more likely than women to own transport-related assets, so these have implications for time use as well as being high value. Men are more likely than women to own assets relevant to participating in business activities like a mobile phone, computer, internet connection, and general business equipment. They're more likely to own radios and televisions, which are important assets for accessing information. And the only asset owned by more women than men in the sample was a sewing machine. Just to quickly summarize, this is all in the Women's Economic Empowerment Brief and in the section of the report. But we do find in this section that dwelling ownership is related to increased household financial decision-making for women, but not for men. Increased household financial decision-making is associated with increased participation in local decision-making for women, but not for men. Men are just more involved across the board, whereas increased household financial decision-making is associated with increased in local participation for women. Paid work increases voice in the community. Finding is the other way around. It's the case for men, but not for women. So we hypothesize that there's sort of, again, a gender norm creating a ceiling there for women's participation. And then this is a really interesting finding, I think, on work and time use. So on average, women spent 2 more hours on unpaid domestic work and care than men. So for around nearly 5 hours on average. Women without paid work spent 40 more minutes on unpaid domestic work and care than women in paid work. And men without paid work spend 6 more minutes on unpaid domestic work and care than men who are in paid work. So men who are who don't have paid work aren't compensating for it by increased levels of contribution around the home, whereas women who don't have paid work are. And you can see that women are doing sort of 4 or 5 hours of, over 4 or 5 hours of unpaid work, domestic work, compared to about 2 hours, 40 minutes for men. One final note I want to make before I conclude. We have created from the Solomon Islands data a secure analysis tool for stakeholders, so anyone in the room can access it. It's de-identified data, there's all items and dimensions, additional analysis, it's interactive, there's visualizations, you can download the data tables, it is secure, it's suitable for low bandwidth, and you can register with IWDA for free access to it. And the idea is to reduce barriers to access. You've got a lot of data in the report, but for people who are interested in their own analysis, we do have this tool that's available. To conclude, I think we did do what we set out to do, which is provide crucial information about the economic, social, political, and environmental dimensions of the lives of men and women in Central and Guadalcanal provinces. I think we demonstrate that poverty isn't just monetary, it's not experienced by all members of a household equally, and it is linked to gender inequality inside households. Individual level data is quite a powerful tool to address gender inequality through visibility, validation, and accountability. We hope the IDM Solomon Islands findings can be used to inform policy, planning, budgeting, COVID-19 response, and because it's representative at the provincial level, it can be considered a baseline for monitoring purposes. And we suggest that a nationally representative sample in the future rolling out to other provinces could be a really powerful tool for informing these priorities. To note for everyone that following the conclusion of the program in June 2020, partners, ANU and IWDA, are now taking forward the work in exciting new directions. This will be under Equality Insights for IWDA and the Individual Measure of Multidimensional Poverty by the ANU. All details are available on the IDM website. Contact information, so there's an email there for a colleague to access the analysis tool. Any research-related questions can come to me, and Ruth can provide my email address. I'm really happy to answer any questions and can make myself available for more detailed briefings if anyone is interested. And then just huge thanks. I've put the photo of Ruth on the end because I really want to take this moment to just say what an incredible job Ruth and Dignity Pacific have done, and what an honor it's been to work with a women-led, locally owned data collection organization. I'm sure it's just the beginning. Thanks to DFAT for the support throughout the 4 years of the program, WFP for the Solomon Islands study, and to all of our partners and colleagues in Solomon Islands government and the women's rights movement, Hannah Wheaton and Jen Walker at IWDA, and the High Commission in Honiara. We couldn't have done it without you. So thank you for listening and for giving me the chance to share these findings with you. We're really excited about this report. Thank you. So I know that we've gone over time, and there's 15 minutes before the end of the session, and probably lunch is on the way, but if anyone has any questions for myself or Ruth, we're happy to answer them now.
Thank you, Kylie. There are two hands. Can I have the mic? Please. Can you please state your name, organization?